All instruments that have been used or contaminated need to be carefully taken to the nurse's station and put in the basin of pre-soak enzymatic detergent. This basin of detergent will have already been set up by you during opening procedures, as noted previously. If you missed that portion, it is in a white container underneath the sink. You'll need to follow the instructions and place only a small amount of detergent in a basin of warm water. Instruments placed in the basin will need to soak for 3 to 15 minutes, depending on the use of the tool and the amount of contamination. After the tools have soaked in the detergent, you will need to manually scrub the instruments. You will find a black-handled brush with white bristles to do this task. Thoroughly scrub the instruments to make sure they are clean and there are no tissue or fluid residues left on the instrument. After you have scrubbed the instrument, you will need to rinse them in warm water and set them to dry for wrapping. Depending on the instrument, you may need to wrap them, or they may need to be put unwrapped in the autoclave. For our normal foot care packs, you will need only to place them in the sterilization cassette to be autoclaved. After they are soaked, scrubbed, and rinsed, place them in the cassette to be sterilized. In order to assure the cycle runs properly and each instrument is sterilized, you will need to place a sterilization indicator with the instruments. This indicator is very important. If you take instruments from the autoclave and there is no sterilization indicator present, you must re-sterilize the instruments. We must be 100% sure that we have sterilized the instruments before they can be used on anyone else. Place the indicator in the instruments, place the lid on the cassette, and place the cassette in the autoclave. If you are dealing with a pack of instruments, like a nail pack or suture removal kit, or a specialized instrument like a single large curette, you will need to individually or group wrap the set. To wrap a nail pack, you'll need to pull a wide sterilization pouch from above the sink. This pouch is closed at one end and open at the other. The open side has an adhesive strip. Place the instrument with the handles towards the closed side into the pouch. The closed side is actually the side that will be open to retrieve the instruments once sterilized, and instruments are easier to retrieve when the handles are available. You will need to place a sterilization indicator so that the indicator is visualized through the plastic see-through side of the pouch. When you have placed the instruments and the indicator, you will pull the adhesive strip cover off and fold down the flap sealing the pouch. This can then be placed in the cassette, ready to be sterilized. In order to prepare individual instruments to be sterilized, and also suture removal kits, you will need to follow the same steps as the nail pack, except there are a variety of pouches in different sizes you can use. The idea is to minimize bulk, so choose the proper size for the instruments or instrument to wrap. For most individual instruments and suture kits, the long, narrow pouch will work perfect. You will need to remember to place a sterilization indicator in each pouch to ensure the instruments are sterilized. You will then place the pouches in the cassettes or in the tray to be sterilized. You've now soaked, scrubbed, rinsed, and wrapped the instruments in preparation to be sterilized. It's now time to sterilize them. Depending on the type of wrapping you have done, wrapped or unwrapped, you will choose different settings on the autoclave. Each instrument should have by now been placed in the cassette in its wrapped or unwrapped form. The cassette slides into the opening in the front of the small autoclave as demonstrated here. Once in place, you will need to choose the proper cycle, depending on the type of wrapping present. If all of the instruments in the cassette are unwrapped, you will need to choose the button that shows a single instrument. This indicates unwrapped. If you have wrapped instruments, you will need to choose the button that shows an instrument with a pouch around it. The other two options are not necessary for your purposes. After you have chosen the proper cycle, you will need to press the power button and the cycle can begin. It is important that we keep each piece of equipment in proper working condition, and the autoclaves are no exception. Each office houses multiple autoclave units, some big and some small. For use in clinic, you will only need the small, flattened autoclave with the single cassette. The larger autoclaves are designed primarily for large instrument sets that we use in surgery, and there is no need to place clinic instruments in them to sterilize, unless our other machines are undergoing maintenance. There are different types of autoclaves that use different types of sterilization methods. Our machines rely on steam to sterilize our instruments. This being said, it is important that you understand these machines rely on distilled water to do their job. On the top of each machine, you will find an opening for the water reservoir. You will need to ensure that each machine has a full reservoir of distilled water so as to maintain proper sterilizing ability. Just as there is a reservoir of distilled water to do the sterilization, there is also a reservoir of distilled water that is left behind after the sterilization process is complete. This occurs as the steam that is evacuated from the chamber condenses back into a water form. You will need to make sure to check this reservoir frequently, which is found on the floor near the machine, so that it does not fill and overflow onto the floor, creating a water hazard. When the sterilization process is complete and the cycle is finished, there will be an air drying time that will occur at the autoclave. You need to allow the instruments to cool down and air dry as much as they will. When you finally are done with the cycle, the autoclave machine will turn off and a slow, steady beep will ensue. This is letting you know that the machine cycle is done. When you retrieve the instruments from the autoclave, you will place all of the packs on a rack, and all of the unwrapped instruments will stay in place until they can be wrapped and prepared for the rooms. It is important that you understand some of these packs will come out still wet, and they'll need to be dried. So place them in the rack, allowing them to be open to the air to dry.